Cool. All right, everybody, welcome back. This is our January 2021 HIPAA Huddle, our first HIPAA Huddle for 2021, and it is going to be a really good one, I promise. This week, we are going to be focusing on lessons that we've learned, meaning HIPAA Trek, through working with several of our clients that have received corrective action plans from the OCR. So it's going to be pretty exciting to kind of walk through all of those lessons we've learned and get through all of that. Okay, so here we go. Before we get started, I do want to shamelessly promote our podcast. So back in October, HIPAA Trek launched a podcast. We have new episodes every Thursday. And these episodes are interviews with other compliance officers and HIM directors, healthcare executives, and folks that have HIPAA responsibility. So it is a podcast for compliance officers by compliance officers, where we are telling your stories to the world. If you have not checked it out, you can listen to it wherever you listen to podcasts. If you are interested in being a guest on the podcast or know somebody who would be a great guest for the podcast, please be sure to contact Bethany. Her contact information is right there, and we'll get you scheduled to be on the podcast. End of shameless promotion. Now we're going to get started. But before we do, I want to remind everybody that this call is being recorded and everybody will receive a copy or a link to the recording sometime tomorrow. Another thing is, as you are entering into the room, your microphone is not muted. And this is because a HIPAA Huddle is not a webinar. This is a conversation. So we'll be going through a couple of points, and then we would love to have you guys interact and learn and share your experiences as well. Your video is turned off. If you feel like showing us your pretty face, please do, and turn your video on when you are speaking, or if you choose to not, feel free to not turn it on as well. And just the last reminder is, the more you participate, the more we all gain. So the HIPAA Huddle is meant to be collaborative. All right, so here we go. We're gonna dig straight in. One other thing too, though, before we get started, is if you don't want to speak up, you can always send us like messages through the chat box, and we can read it out through there. But I always love it when you guys unmute yourselves and chat. Okay, so the first thing we're going to talk about from the lessons that we have learned in working with the OCR from the Corrective Action Plan purposes, right? So this is after the investigation has already taken place, right? So either a patient has reported you for a complaint and the OCR is investigating you, or you have self-reported a breach. The OCR will work through the investigation process, and then after that, they'll put you on a corrective action plan. So sometimes the OCR can put you on a non-punitive corrective action plan, and that is a corrective action plan that you did not have to pay a settlement for, although more often than not, you will have had a settlement charge as well. So the OCR views their assistance in the corrective action plan process as technical assistance. So in other words, they're like a consultant for you. They're trying to work through and make sure that you're meeting all of the needs, right? So if we look at the process of the corrective action plan as a mechanism for the OCR to help you and your practice and your hospital to achieve the compliance so you never have that type of complaint again. Because what the OCR doesn't want is for you to continue to have the same type of mistakes happening over and over again. And so they're like, okay, if we can get these things done, then we're good, right? So another thing too is these corrective action plans are all public knowledge. So they are posted publicly. So if you ever want to see what a corrective action plan looks like, you can just Google OCR CAP and you will get to see that copy. So, okay, great. So these lessons that we've learned in working through an OCR corrective action plan I'm going to be discussing lessons from two separate clients that we've had. One received the corrective action plan after the non-punitive audits that were happening way back a few years ago. So I think the last one was finished like 3 or 4 years ago. And they just wrapped up the last of their technical assistance as part of that corrective action plan. And the second is a client of ours who was one of the 14 covered entities that had settlements under the patient's right of access. And what's really interesting is both of these clients had very similar experiences and feedback from the OCR. So the first client that was with the non-punitive audit, they were a critical access hospital. And then the one with the patient right of access is a small one provider, one employee clinic. So an extremely small covered entity. So, and the lessons were the same from both. So when you first get contacted and are told that you're going to start your corrective action plan. Oh, we got a question, Sarah. Yes, ma'am. Someone's sending me a message. Okay, so access to the presentations. I will be sending a link out with the recording, and then you also get the deck. And these are typically sent like the next business day. So all of y'all that were on the special huddle yesterday will receive the link and deck today. And then this will be out tomorrow. Okay, so when you first get your corrective action plan from the OCR, the very first thing that you're going to do is send all of your policies and procedures around the deficiency to the OCR. So for example, the patient right of access, the clinic was asked to send all of their privacy policies that have to do with uses and disclosures of PHI. So they had to send all those policies and procedures out, and they also had to send their notice of privacy practices because there are patient rights detailed in that notice of privacy practices. The OCR then will review everything and then schedule a call with you to go over all of your deficiencies that they cover. And here's kind of the things that we've seen from both of them. So one of the things that they really, really want to make sure that you know is that your policies and procedures are more than a checkbox. So an exact quote, so I'm going to pull up my notes here from my last call with the OCR, is that they want to make sure that your policies do not become an exercise in box checking, which is not what the HIPAA privacy rule wants. So, and that is true also of the security rule. So if you have a security rule process, then you have that as well. Okay, so I have a question here. So I did a corrective action plan on my own prior to reporting next month. Does that have any influence on the OCR's plan? So question, is that related to an incident that you are, and so you did a corrective action plan around the incident on your own, or was this, you've created corrective action plans based off of your own internal auditing? Just because—
Hey, Sarah, it's Joni.
Hey, Joni. I was like, I know you do a lot of internal auditing, so.
Right. Well, no, we actually had an incident, and as part of my corrective action plan, we implemented some additional training.
Awesome.
For that group and testing.
Oh, that's perfect.
So are they going to make me do an additional corrective action plan?
So when the OCR, when they are in that investigation process, I would submit to them the corrective action plan that you created for your internal uses, because that will have an effect on how they create your corrective action plan. Because if you do have a settlement or they do the investigation, you will have a corrective action plan.
Okay.
So from the OCR, because they will find something to work with you on. But we need to look at it as help, right? It's free consulting from the government entity. And if we look at it that way, because once you report it, it's kind of out of your hands on whether or not you'll receive a punitive thing, but we can talk about that later too, Joni.
Okay, fine. I used your videos for training, so.
Awesome, thank you.
Yeah, you're welcome.
Yeah, so, okay, so going back. So the OCR wants us to make sure that our policies are more than this exercise in check boxing. And I know that this is one of the biggest temptations that we have, right? Is we want to look at HIPAA and pretty much anything that we do as a series of check boxes that we need to do, right? And so one of the things that we recommend before you ever even get involved with an OCR corrective action plan or audit or an investigation is to ensure that you understand that your compliance is like managing disease, right? So we're all in healthcare and we understand when we're talking to providers or nurses, they understand if you're talking to a diabetic patient and you've given them a list of things that they need to do to manage their diabetes, and these are ongoing lifestyle changes that the diabetic needs to implement, right, to save their life and keep them healthy. HIPAA is the same way, right? So the purpose is it's that list of things that we need to do, that lifestyle change to keep our organization healthy. And so you need to think of your policies in the same way, lifestyle change versus check boxes. So, and remember that compliance is this long journey, and there's no way you will ever say, I'm compliant, I'm done. There's nothing more I need to do. I'll just sit back and watch everything, because you will always have new security incidences. Your weakest links on the privacy side are your people, your employees. So you have to make sure that this is a continual ongoing process. One of the other things that the OCR really looks for and works with you through when you do have the corrective action plan is implementation. They want to make sure that you have a workable plan. So your policy should not just be recitations of what the rule says and copy everything. So for example, in your uses and disclosure, if you're listing fundraising and marketing and research, but you're a critical access hospital that doesn't do any of those things, yet in your privacy policies, you list that you need authorization for those things, the OCR will call you out. They'll say, hey, you don't do any of these activities. Why is it in your policies? So just simply reciting what the rule says without a way for it to tie back to your organization is not the intention. The OCR believes that the privacy rule and the security rule were both written to be sufficiently flexible, meaning they can adapt to organizations of all sizes and types. So we need to make sure when we're creating our policies that they are not just recitations of the regulations, and that we have a workable plan that is either included inside of the policy, so including your procedures and processes inside of your policy, or having separate documentation for your procedures and processes that can tie directly back to your policy as a way to implement. The OCR also will ask for evidence that you've actually implemented your policies and procedures, because that's how they know that it is a workable plan. So every time you do something, just like when we're telling our providers whenever they're treating their patients, right? Every time you do something for compliance, you need to document it. Because if it's not documented, I mean, everybody's already saying it in their heads, right? It didn't happen. We have to make sure that that we have that process in place. And the OCR will work with you to help you to create a workable process, but they're not going to tell you what to do. What they'll do is they'll say, okay, here is where I notice that you need to tighten things up. Here's where I notice you need to do X, Y, Z. And so they'll tell you you need to create a workable plan, but in your head right now, you need to already start thinking about, what am I going to do to have that workable plan, right? So are you going to create Excel worksheets, calendar reminders, an email for different things? Figure out how you're going to actually implement your policies. So here's another thing too, is don't over policy yourself. So we've worked with organizations that have hundreds of HIPAA policies. There's no reason for you to do that. So if we look at it, like, we can tie together policies and procedures, right? So if we look at the risk analysis, risk management, and evaluation requirements of HIPAA, those can all be tied into one singular policy for us to, because they all basically have the same activity, right? So then we have one policy governing three elements of HIPAA, but we can then create a workable plan, because we don't want to over policy ourselves. It becomes too difficult to track and monitor and implement. So before I move on, any questions or comments so far? I've already kind of given a ton of quick information. You're going to see my dog now in the background. He's wanting to say hello. Okay, perfect. So one of the other things that the OCR, so you're gonna see me looking at my notes here, wanted us to do is to create these cheat sheets, right? This was really important for them in implementing the release of records for either patient request, payer request, or third-party requests. And so the OCR recommended in this cheat sheet for it to either be a poster or a checklist that the folks that are responsible for actually processing the records, so they have that information at their fingertips, right? And try to create as much of an automated process as possible so that there will not be a mistake, right? So because with this, the patient right of access, what had happened was the patient requested their records and the practice ignored it. And then the OCR sent out their technical assistance letter and the practice ignored it. Then the OCR sent a second and a third technical assistance letter before they got fined. Or they had the settlement. The OCR doesn't like it when we call it fines. So essentially, that's one of the reasons why these posters and these cheat sheets can be extremely helpful, because then you know exactly how to respond to a patient request so that it doesn't get ignored, right? So if you're unable to process the request, so if, for example, they're requesting psychotherapy notes, you can actually respond back to that request and it never gets to the point of a patient complaint to the OCR. So any place where we can create these cheat sheets or posters to help our employees out is really imperative. And that actually counts as training as well. When you have these posters and these cheat sheets around and you're training your employees on how to utilize these posters and cheat sheets, that is training on your policies and procedures. So you're kind of knocking down two birds with one stone, and that you're ensuring your organization will never have this type, or reducing the likelihood that your organization will ever have this type of incident while you're training your employees on your process. So again, tying as many things together as possible is going to be key. So any questions on implementation, cheat sheets, or policies? All right, cool. Y'all are really quiet today. So another thing that the OCR really stressed in this last corrective action plan that we're currently working on now is having a work from home policy. As you can see, I'm sitting on my sofa. So the OCR is very aware that organizations have remote workforces now. And this includes administrative staff at hospitals and clinics are working from home, if not full-time, part-time. So if you have remote workers, the OCR has said you have to have a work from home policy. So you can call it whatever you want to. The OCR investigator for this particular practice called it a work from home policy. But that work from home policy needs to be inclusive of privacy and security elements. And you also should consider having a bring your own device policy if you're allowed to utilize your own personal device for working. And then the other reminder was, and I'm going to scroll through these notes real quick so I can have the exact wording that the OCR investigator told us. So when you have your inside of your policies, he said that it's a best practice to add in the fees for any third-party directive or patient directive in releasing records. So you also need to ensure that you are including the state statutes, right? So for example, in the state of New York, you can only charge 75 cents per page for a record. So, but if you're practicing the $6.50 HIPAA flat fee, but you're only copying, 10 pages for a patient, you cannot charge $6.50 in the state of New York. You can only charge 75 cents per page. So even though the federal regulation is one thing, and you're utilizing the state statute, you have to make sure that there's no violation of either. So creating a process to evaluate what a record charge should be, and including that in your policy or in your processes so that it is readily available to your employees is incredibly important. Because sometimes folks will either overcharge, not charge at all, or forget to even, or not even do the records request because they get confused on the cost, right? So that is what the OCR let us know. So making sure that you have this documented somewhere, and again, create a little cheat sheet for this. So, or create an Excel sheet that has some logic behind it. So you can input, you know, the number of pages, the type of record request, and it can automatically calculate the fee for you. I think that that is one of the best practices. But remember too, you can only charge for your actual labor and supply cost. You cannot charge for time spent like retrieving the records, and make sure all of that is well documented inside of your policy. So how many of you guys feel confident that if the OCR were to call you, that you have all of these things in place now?
This is Joni. I don't.
It's a lot.
Yeah. I think anybody have any good cheat sheets they want to share with the group, I'm certainly available to look at them.
Well, I can tell you right now too, that we are in the process of creating the records request cheat sheet and poster. So we'll have 3 separate posters, one for patient request, one for third-party request, and one for payer requests. So I will make sure that I can share that with all of y'all once those are done. I'm hoping that they will be done by the end of the month, but it may be early February before we have those done. We are also in the process of creating that Excel cheat sheet for the state, for the record request values. That's going to take us some time because we've got clients in all 50 states. So we're going to build it out for all 50 states, and we'd be happy to share that with y'all as well. And Joni, I would love to work with you on that.
Okay, yeah, that's awesome.
Yeah, because
it looks like a good tool.
I think,
and you know, we write a lot of medical record release policies and for the rural health clinics, and sure would be nice to include that. I hadn't thought about including the fees if the state fees were different from the federal fees in there. I always link back to the federal policy in my policy, but that is a good idea.
Awesome. So Dina, my great friend and most excellent healthcare attorney, is volunteer. She said, I have a sample fee records policy that I am happy to share. So what I will do, Dina, if you're okay with this, is I will copy you on the reply to everybody so that they all have your contact information, so that they can contact you directly for that. That is amazing. Thank you, thank you, thank you, Dina.
I'll just send it to you, Sarah. I'll send it to you so it can go out with the deck.
Oh, you are absolutely amazing. Thank you.
Sure.
And then Ivory says, if anyone is in Texas, I would love to have your contact information to collaborate. I'm new to HIPAA and could use all the help I can get. Ivory, we talked this morning. I'm happy to help you as well, but I know there are a couple of Texas folks on here. I'm actually scrolling through because I want, here we go. I'm going to send somebody a very quick message to see if they are willing to help. So we'll see here in just a minute, Ivory, because I may be able to do an introduction for you to an amazing person right outside of the Houston area. So I know you're outside of Dallas, but we'll see. Then let's move on to employee training. So here, like, I have to tell you, I was a little bit surprised on what I learned from the OCR part in the second, so in the most recent one of our corrective action plans. So everything that we had started implementing with HIPAA Track and our clients on employee training is just the very beginning of what the OCR expects you to do. So you are expected to train your employees before you grant them access to PHI. I think all of us know that. And that training needs to be more than just basic HIPAA 101 training. It needs to be on your policies and processes. I think we all knew that. And then you're also required to send out periodic security reminders to your employees. And these can be on in any medium, right? They can be email, they can be given verbally in meetings, they can be posters, they can be screensavers that you put messages on. So it's really anything to do with that. And that's where we started on guiding our organizations, our clients, on how to train their employees. Last week, I learned something new from the OCR. So when we are training our employees, one of the things that we really need to do is make sure that we are training them in the way that they will understand. So for example, you can give video training with quizzes if you wish to, but the main thing that we want to see is that the employee has a full and complete understanding of their responsibility. We see a lot of times that hand-holding type training works better than any other type of training. So that is something we learned new. So you saw me, I just read that straight from the notes that I took while we were meeting with the OCR. So I think that this is going to become quite the challenge for a lot of folks. If the OCR is looking for us to implement training in the way that the employee will fully and completely understand, and they don't really care how we do that training, there is any number of ways that we can do that. But the challenge I think that a lot of folks are going to have, because I can tell you, we just learned that last week, is that the OCR really wants it to be customized, not just to our organization, but also to the type of employee that we're training, right? So is how are we going to do that, right? So I think that video training and emails are still great starts, but we're really going to have to almost start looking at how our employees like to learn in order to be able to train them. So if anybody has ideas, I would love to hear your ideas on how we can actually meet what the OCR is asking for.
Sarah, this is Dina. One thing that I have had clients do that works really well is to group, you do your video training, but then also once a year or sometimes quarterly, depending on the department, bring your groups together, like your medical records folks together, and have a roundtable discussion about those privacy and security issues that are top of mind for them, and go through scenarios that have come up and look at them in light of your policies and provide that sort of education that's specific to that group. So, I've got one client that has a large call center, and their call center folks often have very different kinds of questions than other people would. Mm-hmm. And so we've grouped training by the type of staff. And so then it's really tailored to the sorts of things that they, issues that they come across every day. And it's worked well for that group.
I like that idea. That's actually a really good one. Then we have, yeah, I like that. And they would have to document that too. I think that that's going to be important, is documenting it and documenting that the employees don't have any questions afterwards. So then Levon told us that new employee training is different today with COVID. Yes, it is. Levon, do you have any tips on how you're training in the days of COVID? We have done some remote. That's, yeah, I think we all are going to have to do that. So then Shayna says, this is interesting. I would think that maybe having to do a poll or survey to see how people prefer to learn. Also what Dina said, breaking it up by departments and duties. Yes. So I think that the poll and survey is interesting, but I would also wonder if that could get us into a bit of trouble. I think, Shayna, because you're in a smaller organization, that would be feasible. But once we get into the hospital settings where you're working with hundreds, if not thousands of employees, that would be more challenging to do. But I definitely think for the smaller entities, that just asking your employees how they want to learn could be extremely helpful. So I think one of the things that we just need to take away and look from this is thinking through ways that we can make sure that our employees really understand. Because do we really know that they understand our policies and processes and how we're actually protecting patient privacy and the security of our data through video type training or emails, or whatever we're doing right now. And I found it interesting too that the OCR does not care if we are giving quizzes or not. They just want to make sure that we are educating and training our employees to the point where they understand. So I found that interesting. We definitely have some work to do there. So another thing that we learned, and this was true 3 years ago when we were working through the CAP, and then even now with this new CAP that we're helping a client with, is the reporting to the OCR. One of the things is when you read the CAPs, they seem super strict, right? You have 30 days to do this. Within 60 days, you're going to do this. However, the OCR can be a lot more flexible with you so long as you are accepting of their technical assistance. So for example, this practice, we had to rewrite around 20 policies, and according to the schedule and the original corrective action plan, we only had 30 days to do that. Well, because we were responsive and we were doing everything within the corrective action plan and meeting all of the other timelines, when we requested a 30-day extension, so essentially giving us 60 days to correct those 20 policies, the investigator was super happy to work with us. So when you are working within these reporting requirements and submission requirements within your corrective action plan, it is very important that you are showing respect and showing a good faith effort to the OCR, because then they will be flexible with you. They understand that you still have a business to run. They understand that you are still seeing patients and doing everything else that you have to do. And this is an added layer of complexity that you're trying to get done. So as long as you're treating them and making that good faith effort, they will be flexible with you, but you need to be showing that good faith effort. Another thing that we have learned too is the OCR does require these annual reports on everything. So they have told us already they're going to be asking to see a summary of our security risk analysis every year for 3 years. They're going to ask to see our employee training reports every year for 3 years. And they're going to ask to see our effort of implementation every year for 3 years. And that's for this patient right of access settlement that we're working right now, which I found extremely interesting that they're asking for the security risk analysis as part of a patient complaint for not receiving their records. So even though you have a settlement in one area, they will tie back other areas that they know are known deficiencies within other organizations. So I found that interesting that they will look at everything and not just what they request, or not just what the breach is about. So one of the things that told me that we really need to be doing right now is looking at our entire HIPAA compliance program to make sure that we have everything in place that we need to have in place, and making sure that it follows, kind of this structure, that it's more than just a checkbox, that you're kind of looking beyond just what HIPAA says and looking at the spirit behind why the regulation is there, right? So I can tell you, like, for an example, you can say your data backup plan is to back up your data once a year, and technically you've met the HIPAA requirement because you have a data backup plan. However, we all know that that's ridiculous. You can't have a data backup plan once a year. You have to back up your data, in a way that protects the integrity, availability, and confidentiality of your information. Right? So when we're looking through everything, if we can make sure that we have all of our policies where they're meeting that spirit of the rule and going beyond just HIPAA, that's going to be key, right? Creating these little cheat sheets and posters and stuff, again, and around more than just patient privacy, right? Or patient rights. Anything that we have a process for that we can create kind of an automated workflow or a workflow cheat sheet, we probably should be doing, especially if it's something we're delegating outside of our office or to somebody else, right? So like the security risk analysis that the OCR is asking for every year, regardless if that's the reason why you have the investigation or not, you know, or the corrective action plan or not, you know, if we can create maybe a cheat sheet so for how we're doing our security risk analysis, you know, like identifying, are we doing it internally? Are we hiring somebody to do it? Are we outsourcing the entire risk analysis or just a portion of it? Here is, you know, the 8 steps that we're going to take to do our security risk analysis. Here's how we're going to be like evaluating all of the risks that are done inside of it. So like really thinking through and having our policies done that way is exactly what the OCR is asking for, at least in our experience in dealing with the OCR, right? Because I think our temptation is having everything be super high level, but I think the OCR wants us to have workable plans. So I think that, because everybody was super quiet today, but I do appreciate everybody's questions. Before we wrap everything up, does anybody have anything else that they want to add, or a different topic that y'all would like to start talking about, since we do have still about 25 minutes left in our time? All right. Well, everybody, oh, here we have one more question. Okay, yes, I will be sending the PowerPoint and the recording to everybody. So, and if you do have any questions afterwards, please feel free to reach out to me. I do want to say another huge, huge thank you to Dina for providing that policy to everybody. That is amazing. Truly, truly appreciate that. And again, if anybody has additional questions, please let me know, shoot me an email. I'd be happy to help you out. Otherwise, have a lovely day. And Joni, I'll be in contact with you shortly. All right, bye everybody.